Hello, thank you for tuning in. My name is Vincy Baby, and I am a researcher at the University of Waterloo School of Pharmacy.
Hello, my name is Tejal Patel, and I am a clinical associate professor at the University of Waterloo School of Pharmacy. We are pleased to present highlights from our article titled Medication Adherence Technologies, a Classification Taxonomy Based on Features, which will be published in Mayo Clinic Proceedings Digital Health. Medication adherence remains a persistent challenge and is particularly important for those who are aged 60 and over. These individuals are often exposed to polypharmacy and complex medication regimens and also face sensory, cognitive, and physical challenges which can affect medication taking and management at home. Technological interventions, which I will refer to as medication adherence technologies, have been developed to address this need. These include devices and systems designed to assist individuals in organizing, remembering, and taking their medications. However, given the diversity of features and characteristics of the available products, it is not always clear which technologies are most appropriate for older adults or how to evaluate them systematically. To address this gap, we developed a comprehensive classification system, or taxonomy, that organizes and describes medication adherence technologies based on their features. We followed a three-step process. First, the development step, we studied over 20 different devices and identified their features. These include things such as size, button design, reminder systems, and connectivity with apps or caregiver platforms. In the second step, we performed a validation. We did so by refining the taxonomy using a Delphi consensus process with a panel of experts, including pharmacists, engineers, clinicians, and older adult partners. Finally, we completed the evaluation step. In this step, we assessed the real-world relevance of our taxonomy by mapping it to feedback we received from older adults who tried out these devices during usability testing of the different products.
As the result of this study, we created a comprehensive taxonomy as demonstrated in the image being shared. In total, we classified 320 specific characteristics. For example, as shown in the box in the upper right corner, we categorized features such as pull tab, punctured blister, and twist cap, etc. under medication access. These characteristics were categorized into 25 subdimensions, which were then grouped into 7 major dimensions, as indicated by the numbered sections in the image. The first dimension is physical features, followed by display, system alert, connectivity, data collection and management, operations, and the seventh one, integration. When it comes to the implications of this study, for healthcare providers, it offers a structured framework to help match device features with patient-specific needs, supporting personalized and safer care. For patients and caregivers, it can help them better understand their options, including specific device features, and choose a product that fits their capabilities and preferences. For technology developers, the taxonomy serves as a developmental blueprint. It identifies which features that should be considered during a device design to make technologies more useful, effective, and accessible for all adults. Finally, for researchers, they can use the taxonomy when exploring the usability or effectiveness of medication adherence technologies in older adults. Although this classification system was originally developed with older adults in mind, our next step is to explore its applicability to other populations, such as individuals with disabilities or mental health conditions. We also aim to develop a clinical recommendation tool that can guide healthcare providers in selecting appropriate medication adherence technologies based on patients' abilities and preferences. We acknowledge the support of National Research Council of Canada and the Canadian Institute of Health Research, whose funding made this study possible.
Thank you for watching this video. To learn more, we invite you to read the full article in Mayo Clinic Proceedings Digital Health. If you have any questions or would like to connect, please feel free to contact me at t5patel@uwaterloo.ca or Bincy at b3baby@uwaterloo.ca.